Why is echocardiogram uncomfortable for stroke patients? Imagine having a tiny camera pushed down your throat to look at your heart. That's what a transesophageal echocardiogram, or T, involves. It's a very useful test for stroke patients because it shows detailed images of the heart and nearby blood vessels. But many patients find it uncomfortable, and there are good reasons for that. The main reason is that the probe is inserted through the mouth and into the esophagus, which is the tube connecting your throat to your stomach. This can trigger your gag reflex, which is a natural response to protect your airway. When the gag reflex kicks in, it can cause gagging, retching, or coughing. These reactions can make the procedure unpleasant and sometimes distressing. The lining of the esophagus is sensitive, and the presence of the probe can cause irritation or a feeling of pressure. To help patients tolerate the procedure, sedation is often used. Sedatives relax you and reduce discomfort, but they also come with risks. For stroke patients, sedation can be more complicated because they might have increased sensitivity to medications or a higher chance of respiratory depression. This means their breathing might slow down or become less effective, which is especially concerning if they already have breathing or neurological issues after their stroke. Many stroke patients have impaired swallowing or altered consciousness, which makes the procedure even more challenging. Because their ability to protect their airway might be compromised, there's a higher risk of aspiration, where food or fluids accidentally enter the lungs. This can lead to pneumonia or other respiratory problems. During the test, the esophageal stimulation can also cause changes in heart rate or blood pressure. For patients with fragile cardiovascular health after a stroke, these reflexes can be problematic. Additionally, lying still for the duration of the test can be difficult for those with neurological deficits or weakness, adding to their discomfort. Despite these challenges, T is highly valued because it provides clearer images of the heart than other types of echocardiography, especially for detecting sources of embolism like blood clots or abnormal openings. It helps doctors identify potential causes of stroke that might not be visible with less invasive tests. But because of the discomfort and risks involved, healthcare providers carefully weigh the benefits against the potential difficulties and sometimes consider alternative imaging methods. In summary, the discomfort of a T4 stroke patients mainly comes from the invasive insertion of the probe through the mouth and throat, which can trigger gagging and coughing. The need for sedation adds another layer of complexity, especially for those with neurological or respiratory vulnerabilities. These factors make the procedure physically and physiologically demanding, even though it can be crucial for accurate diagnosis. Always remember, if you or someone you know needs a T, it's important to discuss any concerns with your healthcare team, who can tailor the approach to ensure safety and comfort while obtaining the necessary information.